Mr. Boyle.
Mr. Chairman, through the Chair, I would like to thank the members of the committee for coming along to listen to this, what I think is an important issue this afternoon. I would like to stress that all my travel expenses and hotel expenses, living expenses coming to this were paid for by myself on my way to a meeting in New York. So I'm not speaking on behalf of any individual organisation or company. I'm speaking on behalf of the global public health community. I'm a member of the National Academy of Scotland, the National Academy of Science of Hungary and the European Academy. I've got what some people would say an extensive publication record in public health, and I was recently, for 5 years at the mandate, I was the Director of the International Agency for Research on Cancer, which is the World Health Organization Cancer Unit, and that was based in Lyon. I'm here today to talk about this issue. It started off with me in the late 1980s when I was involved in a very large international study involving several tens of thousands of people who had cancer and were given chemotherapy, and we established that there was quite a significant excess risk of second primary cancers in patients getting specific types of chemotherapy. In addition, we also discovered that there was problems with nurses in terms of excesses of bladder cancer associated with certain types of chemotherapy, and also they suffered more premature births, more malformations, and more problems with their pregnancy. So it was a very important point that came out of that was that there was a change in how the regulation for preparing chemotherapy in hospitals. Those specific extractor fans and hooded compartments established that the only place in hospital where you could prepare those chemotherapy to prevent the exposure to the nurses, to the medical staff and to other auxiliary staff in the hospitals. Of course, there are specific rules in hospital for the disposal of waste, those people getting radioactive tracers, for example, and the patients receiving chemotherapy. There are specific norms for the disposable and the capture and disposal of waste like that in hospitals, but nothing in communities. A lot of people now, and there's an increasing tendency, there's more and more people around the world with cancer, particularly in the high-resource countries, because of the growth and ageing of the world's population. There is an increased move for people to get chemotherapy in hospital as outpatients and then to have to go home. And we've established that in patients who receive chemotherapy, for the 2 or 3 days following that chemotherapy, there are 27 different types of chemotherapy which lead to the excretion in either sweat, vomit, urine or faeces, 27 identified human carcinogens which are excreted in that format. Patients, when they go home, depends on countries. Some doctors tell the patients to, if you've got 2 toilets, just use one for yourself. If you use a toilet, flush twice. But that doesn't get rid of the problem, because the problem is that these chemotherapeutic agents, these human carcinogens, are going to end up somehow in the water and the sewerage supply. And that is really quite an important issue. The principle involved here, the basic principle is to recognise this as a public health issue which requires steps to be taken to do something about it. This is a key important issue. I think that the time has come. I blame myself to a large extent, because it was only a year ago that I thought, this is important. This is something that we haven't taken care of. In science and medicine, we've taken enormous steps to identify chemicals, identify lifestyle factors which are important causes of cancer, and yet we've taken steps to do everything we can to prevent the exposure of the population to this. And this is an area where it has slipped through the net, and one in which I think that the scientific, medical, oncology community, of which I'm a member, I'm here to say mea culpa. This is something that we forgot about, took our eye off the ball, and I think it needs urgent attention. I think there are 2 major issues. The principle is that this must be recognised as an important threat to the health of carers, family members and the general population who may be exposed to these carcinogens through the water or accumulation in sewerage or whatever exposure could be. We need to do more work on that. But the underlying principle is that we need to recognise that as an issue, and then the political issue is who do we get to actually pay for this to make sure that we can get rid of this, minimise this or eliminate totally this exposure to the general population. I really thank you for your attention. I hope that you can consider this bill, but I think the important thing is, first of all, get the underlying principle out there. We need leadership in this area to say that this is an important issue that we must take steps to avoid. Thank you very much for your attention, Mr. Chairman.
Are there any questions? I have one question. There has been some... The issue on this in past years that we've had similar legislation has always been who pays and how do we pay.
Yeah.
And that is more complicated post-Affordable Care Act, in that if it was mandated that it be paid by insurance from the revenue from insurance, that it could potentially be determined as a state liability. And so, based on previous testimony, we understand the issue very well, but we still have who's going to pay as a complexity. One of the things that has been discussed recently is the concept of producer involvement, as it has been taking place with lead paint, mattresses in Canada and other locations, electronics, and there are several examples now of those systems working very well. So has that been explored as part of a solution for financing this type of...
I must confess I'm not an expert on the legislation in different states in the United States, but there's others with me and this here today who maybe elucidate on that. One of the things which drives me on is this: one of the great things for environment and public health, this is an environment and a public health issue, was the work of Ralph Nader in the 1970s, where he was mandated to lead, the government mandated him to have a reduction in motor car exhausts. So he got the big manufacturers together and they said, we can't do it. No, we can't do it. He said, okay, fine, you can't do it, but you'll get 2 years to half your emissions. So they all come back in 2 years' time and say, yeah, this is wonderful, we've done it, right? And they said, great, you've got another 2 years to half it again. And so there was a political will to have this, but the responsibility for doing it was left to the manufacturer and the cause of the pollution. And I think that's a good analogy for going forward here. Since then, we've got every car I know has got a catalytic converter, and that's one of the great things that come out of the industry work to produce that. So I think we need to look for imaginative solutions to solve this problem, but the important thing is to declare that this is a problem.
Thank you. Any other questions? Thank you.